Welcome to the unit on digital health data management and confidentiality. I am your instructor, and over the next few sessions, we will explore how modern healthcare systems manage, store, and protect patient information. From hospital systems to international data standards, we will dive deep into the tools and ethical principles that shape digital health today. Let's begin. Healthcare service provisioning now extends beyond the walls of hospitals, powered by interconnected systems that bring together patient records, imaging data, and real-time monitoring. From the first point of contact, digital platforms capture and organize health information, ensuring it is accessible to clinicians when and where it's needed. Diagnostics have become faster, more accurate, and more collaborative. Advanced imaging, lab results, and sensor data are analyzed instantly by AI-driven tools, flagging early warning signs and supporting clinical decision-making. Specialists across different locations can review the same synchronized data, enabling joint consultations and tailored treatment plans without delay. This integration of service provisioning and diagnostics not only speeds up care but makes it more precise, patient-centered, and accessible. Digital healthcare is shifting the model from reactive treatment to proactive, data-driven care, improving outcomes while transforming the way healthcare is delivered worldwide. A hospital information system, or HIS, is the backbone of digital operations in a healthcare setting. It is an integrated software platform designed to manage the clinical, administrative, and financial activities of a hospital. HIS supports doctors, nurses, administrators, pharmacists, lab technicians, and even patients by streamlining workflows, reducing errors, and improving coordination. Most HIS platforms consist of modular components that serve different departments. These modules include electronic medical records for storing patient histories, laboratory information systems for test results, radiology information systems, billing, and pharmacy management modules. Each module communicates with others to provide a unified view of patient care. Implementing HIS in hospitals results in multiple benefits: quicker access to patient information, reduced chances of duplication or errors, seamless billing, and improved regulatory compliance. It helps administrators optimize resource allocation while giving clinicians instant access to real-time patient data, thus enhancing diagnostic accuracy. Healthcare data can be broadly categorized into three types: administrative data, related to billing, insurance, and operations. Clinical data includes diagnostics, treatments, medications, and lab reports. Patient-generated data, collected from wearables, apps, or self-reports. Understanding these helps in designing systems and policies for accurate data capture, storage, and analysis. While often used interchangeably, EHR and EMR are distinct. EMRs are digital versions of paper records in a single clinic or hospital. They help track data over time but do not easily travel outside the institution. EHRs, on the other hand, are designed for interoperability. They are shared across clinics, labs, and specialists, giving a comprehensive view of a patient's care journey. Modern EHR systems include features such as decision support tools, automated prescription alerts, access from multiple locations, integration with wearable devices, and data visualization tools. These functionalities help clinicians make timely and informed decisions. Beside HIR and EMR, the most effective tools are 1. Telemedicine platforms. Telehealth tools enable remote patient consultations, monitoring, and follow-up care, expanding access to healthcare services and improving patient convenience. 2. Secure messaging and communication tools. Secure messaging apps like Signal or Microsoft Teams facilitate real-time communication among healthcare professionals, enabling quick consultations, efficient information sharing, and timely responses to urgent situations. 3. Project management software. Tools like SmartSuite, Asana, Trello, and ClickUp help healthcare teams organize, track, and manage projects, tasks, and resources. 4. AI-powered tools. AI is revolutionizing healthcare with tools like DeepScribe, automates medical note creation. Zebra Medical Vision analyzes medical images for disease detection. Qventus optimizes patient flow and resource allocation. Informatica provides symptom analysis and care recommendations. 5. Scheduling and appointment management. Software like Acuity Scheduling streamlines appointment booking, reminders, and management, reducing no-shows and improving patient flow. 6. Billing and coding systems. Automation of billing and coding processes simplifies revenue cycle management and reduces errors. 7. Collaboration platforms. Tools like Slack and Google Workspace, formerly G Suite, enhance team communication and collaboration, especially in large healthcare organizations. Google Workspace enables collaborative work through Google Docs, Sheets, Slides, and Calendar. Doctors can co-author reports, staff can schedule appointments using Google Calendar, and teams can securely store documents in Google Drive, with real-time updates and access control. Google Workspace is transforming collaboration in healthcare environments by bringing essential tools together in a secure, cloud-based platform. With Google Docs, Sheets, and Slides, healthcare teams can co-author patient reports, research papers, and presentations in real time, eliminating the delays of sending files back and forth. Changes are instantly visible to all authorized users, ensuring everyone works from the latest version. Google Calendar streamlines appointment scheduling, doctors can coordinate consultations, staff can manage patient visits, and departments can align their timelines without overlap. Shared calendars make it easy to track availability and send automatic reminders. Google Drive serves as a central, secure repository for storing clinical guidelines, training resources, and administrative documents. Built-in access controls ensure that sensitive files, such as patient records, are only visible to authorized personnel. Real-time syncing means these documents can be accessed from any device, anywhere, without compromising security. Together, these tools create a connected workspace where healthcare providers, administrators, and support staff can work seamlessly, efficiently, and securely, ultimately improving coordination, productivity, and patient care. Word. Used for creating and editing reports, patient summaries, research papers, and other textual documents. Excel. Utilized for data analysis, creating spreadsheets to track patient data, financial information, research results, and more. Excel also has features like pivot tables and charts for in-depth analysis and visualization. PowerPoint. Employed for creating presentations to share research findings, clinical updates, or administrative reports with colleagues, stakeholders, and other audiences. Access. Used for managing databases, storing and retrieving patient records, research data, and other information. Specific examples. Reporting. Hospital administrators can use Word to create monthly reports summarizing patient admissions, discharges, and other key metrics. They can use Excel to analyze financial data related to these metrics and PowerPoint to present these findings to the hospital board. Research. Researchers can use Word to write research papers, Excel to analyze data from experiments or surveys, and PowerPoint to present their findings at conferences. Data analysis. Excel and Number 39's Analyze Data feature allows users to ask questions about their data in natural language and receive visual summaries of trends and patterns. Additional resources. Care Management Analytics. Microsoft Fabric offers care management analytics capabilities that can be used to build analytical models, conduct patient population studies, and create Power BI reports. Microsoft Fabric provides a platform for healthcare data solutions, including tools for data ingestion, transformation, and analysis. What is health data interoperability? Interoperability refers to the ability of different healthcare IT systems to communicate, interpret, and use shared data. When a patient visits a new hospital, their health history should be accessible to the care team without any data loss or misinterpretation. True interoperability ensures better outcomes and fewer repeat procedures. Standard data formats in healthcare. To achieve interoperability, health systems must use standard formats: DICOM for medical imaging, HL7 for structured messages, CSV for spreadsheet-style data. These standards allow diverse systems to read and interpret health data uniformly, regardless of vendor or platform. DICOM in medical imaging. DICOM, or Digital Imaging and Communications in Medicine, is a widely used standard for handling, storing, and transmitting medical images. Radiologists and clinicians use DICOM viewers to read X-rays, CT scans, and MRIs. The standard includes not just the image but also metadata, such as patient info, scan type, and date. DICOM files typically have a .dcm extension and provides a means of storing data in separate tags such as patient information as well as image, pixel data. A DICOM file consists of a header and image datasets packed into a single file. The information within the header is organized as a constant and standardized series of tags. By extracting data from these tags, one can access important information regarding the patient demographics, study parameters, etc. 16-bit DICOM images have values ranging from -32,768 to 32,768, while 8-bit grayscale images store values from 0 to 255. The value ranges in DICOM images are useful as they correlate with the Hounsfield scale, which is a quantitative scale for describing radio intensity. HL7, or Health Level 7, is a globally recognized framework of standards designed to enable seamless data exchange across different healthcare systems. It provides a common language for structuring and transmitting clinical and administrative information so that hospitals, laboratories, pharmacies, and other healthcare entities can communicate effectively, even if they use different software platforms. At its core, HL7 defines how key types of data, such as patient demographics, medical histories, diagnostic imaging results, laboratory findings, prescriptions, and appointment schedules, should be formatted, coded, and transmitted. By enforcing this consistent structure, HL7 ensures that information generated in one system can be accurately interpreted and processed by another without manual re-entry or risk of data misinterpretation. These standards are essential for enabling interoperability in complex healthcare ecosystems. For example, a patient's lab test ordered in one hospital can be transmitted electronically to a specialist's clinic using HL7 messages, with results appearing instantly in the specialist's electronic health record system. Beyond day-to-day operations, HL7 also supports public health reporting, research data sharing, and integration with emerging digital health tools, such as mobile health apps and AI-based diagnostics. By creating a universal grammar for healthcare data, HL7 plays a critical role in ensuring that vital information flows securely, consistently, and efficiently, ultimately improving coordination, reducing errors, and enhancing patient care. CSV, or comma-separated values, files are simple and easy-to-use formats for exporting tabular health data. Hospitals may use CSVs to transfer appointment lists, inventory reports, or even large-scale anonymized research datasets. Their simplicity makes them highly portable and readable. Importance of data privacy in healthcare. Privacy in healthcare is not optional, it is both a legal mandate and a profound ethical duty. Laws such as HIPAA in the United States, GDPR in Europe, and similar regulations worldwide are in place to ensure that patient data is collected, stored, and shared responsibly. Beyond legal compliance, there is a moral responsibility. When patients share sensitive health, personal, or financial information, they are placing deep trust in healthcare providers and institutions. A breach of that trust can have far-reaching consequences. For patients, it can cause emotional distress, embarrassment, or fear that their personal health conditions will become public knowledge. In more severe cases, stolen data can be used for identity theft or insurance fraud. For institutions, the fallout can include heavy financial penalties from regulatory bodies, costly legal actions, and the loss of credibility in the eyes of the public. Damaged reputation can erode patient confidence, reduce service utilization, and even impact funding or partnerships. What is HIPAA? The Health Insurance Portability and Accountability Act, HIPAA, is a U.S. federal law enacted in 1996. It outlines rules for how healthcare providers and associated entities must protect and handle patients' health information. HIPAA mandates standards for electronic health transactions, data privacy, and breach notification. HIPAA sets strict requirements for protecting patient health information, and its safeguards are organized into three key categories: administrative, physical, and technical. Administrative safeguards focus on policies, procedures, and workforce training. They ensure that healthcare organizations have proper risk assessments, security management plans, and clearly defined roles for handling patient data. This includes developing incident response procedures, assigning a security officer, and regularly training staff to recognize and prevent